Hey everyone, this is Dr. Lisa Holland, integrative physical therapist and women's health coach down here in Charlotte, beautiful Charlotte, North Carolina. And today I thought we would discuss deep core. So part of successful living is understanding your physical body. And I work with a lot of men and women who have no clue what's going on in terms of the pelvic region. They know their hips are tight, they know their back might ache, they know they might even be a little bit weak as they get older. They might be noticing things such as incontinence or sexual dysfunction, or even things such as falls or feeling unsteady. And a lot of times, more times than not, things of imbalance such as muscular patterns of use or even hesitation and mindset and how they're approaching things, their behaviors in negotiating things such as stairs or how they're doing exercises or just working with the path of ease creates an ongoing problem that might have worked for them years ago, but now is causing there to be either an injury or a secondary injury, or that secondary injury that's happened through something else going on, or just aging in terms of wear and tear, may now not let that first dysfunction be so helpful. So what we're going to do is talk a little bit about just bringing in deep core and just understanding that you have a lot going on inside. We have all our insides, our guts per se. But we're really going to be looking at a couple of key things. There's 4 key components to your deep core. That is the pelvic floor, okay? And in women, it's a little bit wider and broader. Obviously, the hips are a little bit more narrow in a male. This is a female pelvis. There is the transverse abdominis. Now, the transverse abdominis comes in on fibers. It comes medial inwards and then downwards, and it comes into this line that people have called the linea alba, or the fascia in the deep abdominals. And the transverse abdominis is your deepest muscle in here, and increases the pressure. So it's really meant to support and increase the intra-abdominal pressure here. It's a brace. It's like a belt. Then there's the multifidi. Now the multifidi rises from in here in the sacrum. This is your sacrum, your pelvis, your sacrum and the iliac crest on the sides that make up your whole pelvis. And it comes up through here. They come up on the sides here from these little arms on our joints, our bones in our spine, okay, the little arms into the middle bones that you can feel when you touch your back in that middle line. That's called the spinous process. So it'll come from the lamina, which is these spaces, this space bridge between our arms and the body of it, and the inside aspect of a spinous process. So they're on a diagonal like that. And they tend to cross 2 to 4 levels. So they're really like guide wires helping for extension, because they lift up towards the spinous process. So they're actually going to lift up and open this facet joint, this joint between the 2 levels of bone. Okay, so they work really well to extend us, lift us up out of our pelvis and make us tall, as well as help with some rotation because they're on a diagonal, right? So they're on a diagonal. So they're stabilizing us as we're rotating and moving and bracing, because a lot of times things will come at us on diagonals. We move on diagonals. We really don't move forward and forward and back straight. The next one is the diaphragm. And for that, I'm going to show you this guy. Okay. He's minus some limbs. He's been through the war. And that is dome, and it's a dome like my hand here underneath. And so when we breathe in, the ribs are supposed to expand and have some mobility, which means our spine in the middle needs to be able to move. Okay, if this is all stuck and tight, even in our shoulder blades, we might have problems doing that lateral expansion. And when we do that, when we inhale, the diaphragm flattens and broadens and increases the opening in this thoracic area or this middle body, which then allows physics to happen, and you breathe in the air and it gets sucked in. So inhales are effort on the contraction of the muscles, but shouldn't be resistance from internal pressures. When we have dysfunctional breathing, we are not going to be able to respirate very well. And those are two different things. Breathing is the act of having all these mechanics and things going on, and also in our mind what we're telling our muscles to do. Because when we were babies in an embryo, before we were even like a baby, just as an embryo, and we made the nervous system, that notochord that first gets formed, from that is where we get our musculoskeletal system, our muscular system. So we have a really big connection between what we're going to do in our muscles with our nervous system. It's a feedback loop. Okay? So we talked about pelvic floor, we've talked about transverse abdominis, we've talked about diaphragm, and we've talked about multifidi. And so those come together to do the postural set. And that postural set, because of that connection with our breathing, with our pressures in between these two chambers, the abdominal chamber and the thoracic chamber, will become a mind-body thing. And so we can interrupt that by what's going on in our hesitation to be using some of these mechanics, and also our awareness or our lack of awareness because of joints or information coming in from the joints or our sensory system, or even our cognitive ability to understand when we want to make a volitional action, such as needing to learn the motor pattern, like if you're learning a new sport. And so we need to have that skill not only from what the body's going to sense to prepare ourselves in those 4 units or those 4 different areas of muscle for bracing and supporting the body, but it also is then going to, at the deep core, wake up the brain to be at attention to what is needed, to be perceiving what is needed for our bigger muscles that you might know, such as the rectus abdominis that goes up and down, such as our latissimus dorsi that stabilizes us from the side and into our arms, our shoulder girdle muscles, our hip girdle muscles. And so when we are in dysfunction with that communication, initiated from that deep core, sometimes we will overutilize or strain or overwork from the outside in instead of the inside out. So that's a little few minutes tidbit on deep core. I hoped you liked that, and be following yourself for successful living to stay out of pain and strain. Take care.